Hey everyone, welcome back to my channel and welcome to another edition of Health Class. So today we will be discussing one of the most common diseases in the world and one of the common heart diseases in the world. We will be talking about ischemic heart disease. What is ischemic heart disease? Who are at risk of getting this disease? What are the symptoms? So keep on watching. My name is Ryan and I am specializing in diabetes, men's sexual health, primary care, and alcohol and other drugs. Today, we will be discussing about ischemic heart disease or IHD. Ischemic heart disease is one of the most common heart diseases in the world. So what is ischemic heart disease? First, we will define what is ischemic or ischemia. Ischemia means holding back of blood. That means there's not enough blood flow to the heart. There's not enough blood flow to the heart. In order for the heart to function, the heart needs oxygen. If there is not enough blood supply to the heart, that means there's not enough oxygen as well that the heart can use. The oxygen serves as the food for the heart. If the heart lacks food, then the heart will suffer. So simple. Ischemia, ischemic heart disease, there's not enough blood flow to the heart. There's few reasons why, but the most common reason, fatty deposits in the wall of the arteries carrying blood to the heart. There are plaques, there are fat deposits or fat materials in the lining of the arteries supplying blood to the heart, making the arteries narrow, making it hard for the blood to get through to the heart, leading to a reduced blood supply to the heart, leading to a reduced oxygen supply to the heart. Now these deposits, these fatty deposits in the arteries will get bigger and bigger as the time goes by, and then as a result those arteries become more narrow, making it more hard for the blood to get through to the heart, depriving the heart of oxygen and nutrients in order for the heart to survive, in order for the heart to keep on working. Now these plaques can rupture as well. If the plaque will rupture, it can tear off the artery wall, which can cause clot formation, which will further obstruct the blood flow. You might be wondering, what is a clot? Well, a clot is a hardened blood in the veins. When the blood clot blocks the blood flow to the heart, this is called myocardial infarction or heart attack, causing the tissues to lose oxygen and then eventually dies. Myocardial infarction or MI causes chest pain, heart failure, and death. Think about a pipe, a water pipe. Think about a water hose. If the pipe or the hose is blocked, then the water is unable to get through. Who are at risk of developing IHD or ischemic heart disease? There are a few. Are you at risk of developing ischemic heart disease or IHD? Some of the risk factors are age. For men, 45 years old and above, they are at risk. And for women, 55 years old and above. People who are also suffering from diabetes, they are at risk. People with high cholesterol, high blood pressure, people who are smoking, people who are not exercising, people who are obese or overweight. Stress and anxiety are also risk factors. Stress and anxiety can cause hormonal imbalances. Recreational drugs or drug use such as cocaine, heroin, to name a few. and pre-eclampsia for women during pregnancy. So what are the common symptoms of ischemic heart disease? I've already mentioned a few earlier, but they are chest pain, shortness of breath, sweating, palpitations, fatigue, irregular heartbeat, to name a few. And you might be wondering, how can it be diagnosed? Well, there are a few tests to diagnose ischemic heart disease. There is ECG or electrocardiogram. There's also echocardiogram, stress test, angiogram, heart scan, blood test, and also physical examination, as well as personal and family medical history. It is very important to speak to your doctor if you are experiencing shortness of breath or chest pain, or if you easily get tired and sometimes too tired. If you think that your heart rate is too fast and irregular, you should be speaking to your doctor. What about the treatment of ischemic heart disease? Well, there's also a few. First and foremost, it is important to do self-care. If you are smoking, you need to quit smoking. If you are overweight, you need to lose weight. You need to start moving, and you need to increase your exercise and exercise daily. Consume low-fat diet and high-fiber diets. There are medications as well that you can take, such as the statins or the cholesterol tablets. There's also anticoagulants. What are anticoagulants? Anticoagulants, they prevent blood clots from forming. We also have beta blockers. Beta blockers medication, they reduce heart rate as well as blood pressure. We also have anti-anginal. Anti-anginal are medications to reduce or prevent chest pain as well as chest pressure. We also have calcium channel blockers tablets. These tablets relaxes blood vessels. And for operations or surgery, we have coronary stent, angioplasty, and bypass graft. In coronary stent, a tube is placed in the arteries to keep them open for blood flow. Angioplasty is done by unblocking an artery by inflating a balloon inside to keep it open. And bypass graft is a procedure that uses another vein to bypass a blocked one. Let's recap. Ischemic heart disease is a condition wherein the heart is not receiving enough blood supply and not enough oxygen. As a result, the heart will suffer because the blood couldn't get through to the heart. It is very important to listen to your body and to assess whether you have the symptoms such as chest pain, shortness of breath, sweating, fatigue, irregular heartbeat, or palpitations. You need to speak to your doctor immediately. The management are very straightforward. You need to do self-care. If you think that you are overweight or obese, you need to lose weight. You need to start thinking about the food that you are eating. If you are smoking, you need to quit smoking. Nicotine can also cause the narrowing of your blood vessels and your arteries. So if you already have plaques in your arterial wall and you already have fatty deposits in the lining of your arteries, plus you smoke, the more that the arteries will be blocked because of the nicotine deposits in the arteries. You need to increase your exercise, and you need to exercise on a daily basis. Plus, there are medications that you should be discussing with your doctor to find out which one is more suitable for you. Just a little bit of a trivia. Ischemic heart disease is the #1 disease in the world. According to the World Health Organization in 2019, pre-pandemic, ischemic heart disease is ranked #1 as the most common disease that people experience around the world. That's it, everyone. I'll be talking about myocardial infarction or heart attack in my next video. Thank you for watching. Share this video to those people whom you think are suffering from heart diseases, particularly ischemic heart disease, and to those people whom you think can benefit from watching this video. Thank you for watching my video. Stay safe and be healthy.